Hi, it's Dr. Lauren, and recently have had a lot of people asking me about prebiotics, of which I did a very short post yesterday, as to why I typically don't use them. And the reason for that is that in a lot of cases, the people that I am trying to help have pretty severe digestive issues, and in many cases have had those issues for extended periods of time, whether that's a year, 2 years, 10 years, lifetime. And what I have found, and this is just my personal experience, obviously, a number of doctors probably have a different patient base, and those people may have different symptoms or they may have different needs. And so, this is by no means a catch-all. That the people that I typically work with, when they take a prebiotic, their symptoms will tend to get worse. This may be contrary to a lot of the talk that's out there, but this is just my personal clinical experience. And so I avoid using the prebiotics because I'm trying to get to a bigger issue. I occasionally will use them in a very short time frame, and that may be to just balance things in a different way, very temporarily. I'm talking maybe a week or less, and then I can start from there and almost essentially start over in terms of trying to straighten out their gut flora. So again, nothing particularly wrong with prebiotics, but what I have found is that if you can essentially do food prebiotics and try to balance the flora that way, that's your better bet. But again, I don't want to say they're all not useful. That is certainly not the case. And I'm sure there's some practitioners out there that use them continuously in many cases. And they very well may have a good success with that. So, but in my personal experience, and primarily because I've been asked numerous times recently, I try to not use them, honestly.